So shall we start?
Sure, absolutely. I'll just
Okay,
share my PPT.
sure.
Let's
Good evening,
see
all the
whether it is
aspirants
visible or
of.
not. This is visible, right?
Yes, it's perfect.
Okay, and let me put it in slideshow. Okay. Now, let me just see if the slides are moving forward or not. It is, right?
Yes, so the slides are moving.
Okay, fine. So, as it is going to be a rapid fire sort of a session, and we're going to cover two topics here, infectious disease as well as AKI. I'll be running slightly fast throughout this thing, and maybe if there's something that we can address specifically, then we can talk about it at the end of the session. So this is for the crash course, and so what do you have here? A 65-year-old woman, history of type 2 diabetes mellitus, presents to ICU with fever, hypertension, and confusion. She was recently discharged from the hospital after surgery for diabetic foot infection. She's febrile. Her blood pressure is 85 by 50 mm of mercury, and she has tachycardia. Now, blood cultures are positive for gram-negative bacilli. So, what is the most appropriate initial antibiotic therapy? You can, put your answers in the chat.
Meropenem.
Please put it in the chat. Then it becomes difficult. Well, I believe somebody did get it right. So the answer is indeed meropenem because it is basically a gram-negative sepsis. And it may possibly involve MDR organisms because of a recent hospitalization and surgery. It is basically broad spectrum carbapenem, effective against a wide range of gram negatives, including ESBL producers, and that is an appropriate choice for empiric therapy in this setting. Second one is a 45-year-old male who would present to the emergency department with severe dyspnea, high fever, and a productive cough. Now, he has got a history of smoking and recent travel to an area with a known Legionnaires' disease outbreak. A chest X-ray will show bilateral patchy infiltrates. Now, which diagnostic test is most specific for confirming the diagnosis of Legionnaire's disease? Okay. What about the answers? Okay, so somebody has got it correct. Okay. So the correct answer for this would be the urinary antigen test. It is highly specific. It provides very rapid results, which makes it the most useful diagnostic test for Legionnaire's disease, especially if you're having an outbreak. We go on to the third one. 50-year-old woman admitted to ICU with a severe headache, photophobia, and neck stiffness. She's febrile. Her blood pressure is 110 by 70. You do a lumbar puncture, which reveals a cloudy CSF with a high opening pressure, elevated white cell count with a neutrophilic predominance, low glucose, and high protein levels. So, what do you think is the most likely causative organism? Seems to be easy. So the answer is indeed Streptococcus pneumoniae, most common cause of bacterial meningitis in adults. And you've got classical CSF findings of neutrophil predominance, low glucose, and high protein, which is consistent with bacterial meningitis. Now you've got a 30-year-old male patient with HIV or AIDS and a CD4 count of 50 cells per microliter. They're admitted with a 2-week history of progressive dyspnea, non-productive cough, and fever. His oxygen saturation is 85% on room air. Chest X-ray shows diffuse bilateral interstitial infiltrates. What do you think here would be the most appropriate initial treatment? Okay. Any other takers? Only one? Okay. So the answer here would be trimethoprim sulfamethoxazole or cotrimoxazole. This patient's presentation is suggestive of pneumocystis xerovecii pneumonia or PCP, which is a common opportunistic infection in those patients who have got advanced HIV. That is the treatment of choice for PCP. 72-year-old man, history of severe diarrhea, fever, and abdominal pain. After being treated with clindamycin for a dental abscess, you do a stool test, which confirms the presence of C. diff toxin or Clostridium difficile toxin. So what is the best initial treatment? Okay. B, A, B. Okay. So answer would be vancomycin, basically, and that too oral vancomycin. You've got two options such as IV vancomycin and oral vancomycin. It will still be oral vancomycin. First line treatment for severe C. diff infection, specifically in cases of severe diarrhea and systemic symptoms. Metronidazole is definitely a well-defined alternative, but less effective in severe cases. Sometimes, if the patients are not able to take orally, then these patients are also given, to the rectal route as a retention enema of vancomycin. A 60-year-old man admitted with sepsis due to a urinary tract infection. He's got a history of aortic valve replacement. Now, blood cultures are positive for Enterococcus faecalis. Which of these is most appropriate for treating this patient's infection? There's no ampicillin. Any other options? Ampicillin. The line is solid. Okay. So answer is ampicillin. It is the antibiotic of choice for treating Enterococcus faecalis infections, especially when the strain is susceptible. When the organism is not resistant, it is effective and is actually preferred over using vancomycin. Okay. So now you've got a 40-year-old woman, no significant past medical history, presents with a 5-day history of fever, arthralgia, and a rash. Now, she has recently returned from a trip to Brazil. Examination reveals a diffuse maculopapular rash and conjunctivitis. Which of this is the most likely diagnosis? Okay. Supriya has been the one to answer. Then Rashman Rajan, John Chuku. Okay. Right. So I guess people have got it now. Answer is indeed Zika virus infection. So whenever you get fever, rash, arthralgia, as well as conjunctivitis, along with recent travel to an area with Zika virus circulation, it is highly suggestive of the Zika virus infection. You can get similar presentations of dengue and chikungunya, but conjunctivitis would be more seen or more common to attributable to a Zika virus infection. Okay. Here, you've got a 55-year-old male who presents to you with fever, chills, and a new onset murmur. He's got a history of mitral valve prolapse, and blood cultures are positive for Staph aureus. Now, which of the following complications is most likely if the infection is not adequately treated? Okay, everybody seems to be having a consensus on this. Any other answers? Okay. So here the answer is indeed heart failure. The explanation being that it can lead to infective endocarditis, particularly on a previously abnormal valve, which can lead to valvular insufficiency or regurgitant lesion and subsequently a heart failure if not promptly and adequately treated.